CT stands for computer tomography. So this is a CT scanner. It's sometimes referred to as the donut or a polo mint, and it is a way of imaging the body very quickly. So it uses X-rays or radiation, and we get hundreds of different slices that go through the body, and then we can reconstruct that into different fields in order to kind of get 3D images. It's very quick. We can scan a patient in about 5 minutes, which is great for kind of trauma settings in which we need a quick diagnosis and we need to get the patient up to theatre and some treatment quickly. We have to have cover 24 hours a day, 7 days a week, 365 days of the year. And that is expected to rise by 18% this year. If you were to come in for a scan as an outpatient in our department, you'd come to our reception, you'd book in and they'd advise you to go into one of our waiting rooms. You'll be met by one of our assistants who will maybe give you a drink depending on what we're scanning and get you changed into a gown, again depending on what we're scanning. And then often with a lot of patients we give them contrast or a dye, therefore we'd pop a little cannula in, and that stays in for the duration of the scan and up to 20 minutes after. One of the radiographers would come down into the waiting room and come and bring you to the scanner. We go through a questionnaire with you to make sure you're safe to have the scan and the contrast, and that's your opportunity. If you've got any questions you can ask us then. Then we do the scan, which can take anywhere between about 5 and 15 minutes, and then once the scan's done we'll usually pop them outside for about 20 minutes just to make sure you're okay after having the injection of the dye. After that 20 minutes, one of my colleagues or one of the assistants will come and take that cannula out your arm, and if you're happy then, you're free to go.